After 60, your body no longer whispers. It starts making sounds you can't ignore. Some of these sounds might seem normal, but in reality, they're quiet warnings of potentially serious health issues. And if you listen, truly listen, you might just save yourself. I'm a senior health specialist, and today I want to share 3 sounds your body may start making after age 60 and why you should never ignore them. These aren't hypothetical what-if scenarios. They're real signs I've seen in hundreds of patients. And you deserve to know. Part 1. The crackling or grinding sound in your joints. It's not just aging. If you're over 60 and every time you walk up the stairs, get up from a chair, or bend your knees, you hear a crackling, popping, or grating sound, be cautious, because your body doesn't make that sound just for fun. It's often an early sign of joint structure deterioration. And the earlier you catch it, the better your chance of preventing long-term damage. Magnifying glass tilted left, what's actually happening inside your joints? Cartilage is wearing down. In younger people, the ends of the bones are coated with smooth, springy cartilage, allowing joints to glide easily. But after 60, due to natural wear and tear, this cartilage loses elasticity and may even begin to flake off. No longer smooth. When cartilage wears away, bones start rubbing directly against each other, producing clicking, crunching, or grating sounds. This is known as crepitus, a common symptom of osteoarthritis. Silent inflammation. As damage progresses, joints can become mildly inflamed over time, and the joint fluid changes, leading to even more noise and discomfort. Warning: what might these sounds be warning you about? Osteoarthritis in the knees, hips, or wrists, the cause of up to 70% of joint pain in people over 60. Bursitis, inflammation around the joint, causing a clicking or popping sound during movement. Joint misalignment, malalignment, often painless at first, but speeds up cartilage erosion significantly. Brain: why do so many seniors ignore these sounds? Because they're not immediately painful, and most of us tend to think it's probably just old age. But here's the truth. That mindset is exactly why many patients don't see a doctor until their arthritis has reached stage 3 or 4, when most of the cartilage is already gone, and joint replacement surgery is often needed. Why heavy check mark? What should you do immediately if you hear persistent cracking or grinding sounds? Don't self-diagnose. See a musculoskeletal specialist for a full evaluation. Get an X-ray or MRI to check cartilage thickness, joint spacing, and signs of inflammation. Start early intervention with non-invasive treatments. Proper physical therapy. Supplementing with glucosamine/chondroitin if recommended by your doctor. Weight management if you're overweight. Gentle strengthening exercises for surrounding muscles, e.g., light squats, stationary cycling. Speech balloon expert advice. After 60, your joints are like a machine that's been working nonstop for decades. It will make noise when it's low on oil, when gears are worn, or when the alignment is off. If you don't check it when the sound first starts, you may end up fixing it only after the damage is done. Part 2. Wheezing and whistling breaths. A sound you should never ignore. After age 60, breathing is no longer just a sign of life. It becomes a mirror reflecting your internal health. So if you start hearing wheezing, whistling sounds, tightness in your chest, or feel like you need to strain just to breathe, that is not normal. It's your respiratory and circulatory systems quietly crying for help. Magnifying glass tilted left, what is wheezing really? Wheezing is a high-pitched sound caused by air trying to pass through narrowed or inflamed airways, often due to increased mucus or obstruction. It's usually most noticeable when exhaling, but in severe cases, it can also be heard when inhaling. Warning: top 3 serious causes of wheezing in people over 60. Chronic obstructive pulmonary disease, COPD. Most people don't realize they have COPD until wheezing becomes a regular occurrence. It's often a result of years of smoking or exposure to harmful pollutants. COPD causes irreversible damage to the lungs and is the 3rd leading cause of death worldwide. Congestive heart failure, CHF. When the heart can't pump blood efficiently, fluid backs up into the lungs, leading to shortness of breath, heaviness in the chest, and wet or whistling lung sounds. This can be an early sign of pulmonary edema, a condition that can deteriorate rapidly without intervention. Late-onset asthma. Unlike childhood asthma, asthma in older adults often goes unnoticed. It can be mistaken for chronic bronchitis. Persistent dry cough and wheezing, even at rest or during sleep, are major red flags. Chart decreasing. Why do seniors often ignore these symptoms? Because many assume, I'm just a little tired, my breathing will settle down. Or, I'm getting old. Weak breathing is normal. But the truth is, shortness of breath at rest is never normal. It signals your body is struggling to compensate for a system that's breaking down. YW checkmark. What should you do if you hear abnormal breathing sounds? Observe and document. When does the wheezing occur? Morning, night, while lying down? Is it accompanied by coughing, chest tightness, swelling in your legs, or fatigue? Monitor your oxygen levels at home. If your resting oxygen saturation, SpO2, drops below 94%, seek medical attention. If it plummets even with light activity, this may indicate underlying respiratory failure. See a pulmonologist or cardiologist. Get a spirometry test, lung function test, chest X-ray, or echocardiogram. BNP blood test if heart failure is suspected. Speech balloon expert tip. In older adults, breathing is not just a vital sign. It's often the first warning sign. If you start hearing unusual sounds coming from your chest, don't wait for it to become a desperate gasp in the emergency room. Sometimes, early intervention by just 1 week can prevent a life-threatening respiratory crisis. Part 3. Thumping in your ear. A pulse warning from within your blood vessels. You're sitting quietly, not exerting yourself, when suddenly you notice a rhythmic thumping in your ear. Sometimes it's a soft thud, sometimes like a pulse echoing through your head. It doesn't go away, especially when lying still in a quiet room. If you're over 60, don't dismiss this sound, because it could be a pulse warning of something serious, like high blood pressure, poor blood circulation to the brain, or even an aneurysm. Magnifying glass tilted left. Why do you hear your heartbeat in your ear? This is called pulsatile tinnitus, a type of ringing or thumping in the ear that follows your heartbeat. It happens when turbulent or abnormal blood flow occurs near your ear, allowing you to literally hear the pulse inside your blood vessels. Warning: hidden dangers behind this symptom. Uncontrolled high blood pressure. Elevated blood pressure increases the force of blood through the carotid and temporal arteries, which can create a pounding sound. Many older adults live with silent hypertension for years, with no visible symptoms aside from this subtle hum in the head. Carotid artery stenosis. This is a narrowing of the main artery that supplies blood to the brain. Turbulent blood flow near the ear can sound like a whoosh or thumping. It's a pre-stroke warning sign and can lead to brain ischemia if untreated. Aneurysm or arteriovenous malformation, AVM. Structural abnormalities in brain vessels can cause chaotic blood flow, especially noticeable in silence. If accompanied by dizziness, imbalance, blurred vision, or headaches, seek immediate medical care. Light bulb. Not all ear sounds come from the ear. Sometimes, the culprit is your heart, your blood vessels, or your brain. Many seniors visit ENT specialists, only to find nothing wrong with the ear itself. But the real problem lies in the cardiovascular or neurological system. YW checkmark. What to do if you hear a heartbeat in your ear? Monitor your blood pressure regularly. If it's consistently greater than or equal to 140/90 mmHg, medication and lifestyle changes are essential. Visit a cardiologist or neurologist. Get a carotid Doppler ultrasound to assess blood flow to the brain. MRI or MRA of the brain if additional symptoms are present: headache, dizziness, memory loss. Track other risk factors. Diabetes, high cholesterol, smoking, and lack of exercise all increase the risk of vascular blockages and strokes. Speech balloon expert tip. That little thump in your ear could be your cardiovascular system's smallest, but earliest cry for help. If you hear your pulse inside your head, don't just cover your ears and hope it fades. Listen to it with caution and care, because your body may be warning you of a stroke that's silently approaching. Your body is never silent. It's always trying to speak to you through your breath, your joints, your pulse. And after 60, the goal isn't to chase health. It's to listen carefully and act before it's too late. If you or someone you love is experiencing these signs, don't ignore them. Don't stay silent, because one small action today could save a life tomorrow. If this video was helpful, share it with someone you care about. You might help them catch a serious condition before it gets worse. And don't forget to subscribe to the channel for more practical health insights.